Folks, it's been more than 2 weeks now since the federal government shut down, and one of the points of contention and disagreement are some entitlements that were extended by the Biden administration in relation to the the Unaffordable Care Act, Obamacare. And I just wanted to have a look at this issue of Obamacare in general, in terms of what it has done to the American healthcare system. And hint is that it has made it worse. It has increased premiums consistently since it came into effect in 2014. But before I talk about Obamacare specifically, let me start this conversation with regards to what has happened in the past whenever the government gets involved in in something that is previously done privately and is done and transacted by the private sector. Do you remember what happened with the housing crisis? In 2007, 2008. This thing of the housing crisis obviously did not just happen overnight. It started with an initiative which was called A House for Every American. This initiative resulted in the founding of institutions like Fannie Mae and Freddie Mac. Fannie Mae in particular was founded in 1938. Freddie Mac in its turn was founded in 1970. Freddie Mac being known as the Federal Home Loan Mortgage Corporation, or commonly known as Freddie Mac. Which is a government-sponsored public company founded in 1970, whose stated purpose was to assist Americans to be able to afford homes. Do you remember that? They were saying that at the heart of the American dream is the issue of home ownership. That every American needs to own a home. And because if Americans can't own a home, that means that they cannot participate in the American dream. Who amongst us would fight against such lofty ideas, such lofty aims? But what ended up happening is that with the federal government inserting into the market billions of dollars per year of federal subsidies for housing, housing prices in America skyrocketed. That is what happens. You can go to every sector where the government has intervened with these lofty aims of trying to assist Americans to achieve some lofty goal like universal healthcare, universal housing, or universal education, higher education. What tends to happen is that prices, they just skyrocket. That has been a consistent theme. And on the issue of Freddie Mac and Fannie Mae in particular, it resulted in bringing the entire global financial system to its knees in 2007 and 2008. because it pushes output and more output, which is not based on market conditions. And then eventually it enters into the realm of fraud and massive kinds of fraud. That is what was happening. And then banks then started lowering further and further the requirements that are needed to actually approve loans, which obviously went hand in hand with them selling um, CDOs and all these other contracts, mortgage-backed securities. But then the main issue that was pushing this entire bubble was this lofty idea that started in the early 20th century to mid 20th century, between, let's just say, just before the World War II to around 1970, where there was this notion that housing, if you don't own a house, you are not part of the American dream. Therefore, that the government's job is to make sure that everyone can own a house. And then they started making sure that everyone gets to own a house, even people who can't afford these houses. And it's been demonstrably that this led to the out of control, firstly, of housing prices, which, if one were to look in terms of how prices have increased since maybe the 80s to 2025 in the United States, some increases are more than 1,000% increases, way outstripping inflation, even in years where inflation were at its highest. The kind of increases that have been seen in housing in the United States can't be rationally explained. And a big part of it has to do with the government intervention in inserting billions of dollars per year in this attempt to make sure that everyone gets to own a house. And as if that was not enough, then in the 1980s, when they started the Department of Education, the United States Department of Education, and then these new federally held student loans, which were supposed to help Americans access higher education. What happened in the United States? We started seeing tuition in colleges skyrocket out of control. This has been happening consistently. Each time the government intervenes in a sector, inserts billions of dollars of money and billions of dollars of subsidies, the private sector reacts by increasing prices. And then in 2012, 2012, 2013, Obamacare was passed by the Obama administration. And then since 2014, when Obamacare became law, healthcare premiums have gone up by more than 80% since then. And they are projected to go up by 20% and by 2026, from now to 2026. Where now we can actually safely say that Obamacare made healthcare worse in the United States of America, made affordability of healthcare much worse in the United States of America. The only way that you can pass these government interventions of any sector is if you are, at the same time, you're going to introduce price controls. If you don't introduce price controls at the same time, while we are passing all of these billions of dollars per year in subsidies and money that you are putting into a sector, every single time what has happened and what will continue to happen is that prices will skyrocket. Because the private sector makes a cynical calculation. Oh, okay. Say on average, people who are paying $500 per month for something, whatever commodity that might be. I'm just going to say they're just paying $500 a month for healthcare, and then the government introduces subsidies, which are supposed to reduce the subsidies by, say, 50%. Do you know what private sector does? They immediately increase the subsidies. They immediately increase the subscription from $500 per month to $750 a month. Which means what? Which means now the government is paying 50% of 750. They are not paying 50% of 500. And they don't stop there. They keep increasing. They're increasing. This is what happens. And this is what has been happening with Obamacare. This is what has been happening also with the education space. This is what has been happening with the housing space. Each time the government says, okay, we're going to pay a portion of whatever it is that needs to be paid, subscriptions go through the roof. So, and the problem for me is that I suppose when you're talking these issues or you're debating these issues with liberals, that these people they are religious zealots when it comes to this issue of free stuff, free education, free healthcare, and whatnot. They can't reason. They can't reason to. They can't reason and they can't listen to logic and reason. They can't look at the evidence and the data. The only thing that is in their minds is this is religious zeal that they have that everything must be free. And they are persuaded in their minds that as long as you declare that everything is free, it's good for society, which is not the case. So then what you tend to see happening is that if you want to have socialized healthcare, then you also need to control the prices that the health insurance companies charge the customers. If you are not controlling the prices, then you can't be introducing any socialized medicine. You can't be introducing any kind of socialized housing or socialized education. Because each time you introduce socialized anything and you don't have power to control the prices, prices go through the roof. That is what has happened. And this has been measured several times by those who measure the cost for healthcare. Now, for instance, in 2021, Obamacare had effectually doubled the cost of individual health insurance. Double the cost of individual health insurance. This is in 2021. And the liberals and the Democrats look at this, and instead of saying, no, you know what, this thing is not working, they want more of it. Americans are paying more for healthcare and they're getting less healthcare, having their claims denied, and they're unable to see their doctor while insurers profit from taxpayer subsidies. Even the Washington Post noted that the real problem is that the Affordable Care Act was never actually affordable. This is what the Washington Post said, that Affordable Care Act, Obamacare, was never actually affordable. President Barack Obama's signature achievement allowed people to buy insurance on the marketplace with subsidies based on their income. The architects of their program assumed that the risk pools would be bigger than they tend to be, and as a result, policies cost more than it was expected. Folks, listen to me. Listen to me. Get government out of healthcare. Get government out of housing. Get government out of education. That's really, for me, the stance that I'm holding right now. Nothing that they've done has helped. Everything that they've done has made things worse. Made things worse. Let me know what you think about that.